Hi, I'm Omkaar.
I'm Stephanie.
We just finished our rotation in Yogyakarta, Indonesia with Elective International, and we are very excited to share with you some of the experiences that we've had over this last month.
Yeah, I'm really glad that I chose to do my rotation through Elective International, and I think Omkar agrees. They just made everything very, very easy with corresponding with the hospital and all the paperwork that had to be done before we got there. They made sure we got it all done in time. They gave us a place to stay when we got there. They gave us rides to and from the hospital every day. They picked us up from the airport, dropped us back off at the airport when it was time to leave, and everyone was just really friendly, very nice, very eager to give us suggestions of things to do, places to eat, places that we should see while we were in Jogja.
Yeah, I'm definitely very happy that I chose to do the program with Elective International for many of the reasons that Stephanie just mentioned. The accommodations were truly amazing. And I'm also very happy that I chose to do the program in Yogyakarta, Indonesia. A lot of the city is very rich with culture. The people are some of the nicest people that I've ever encountered in my entire life. There were a lot of fun activities that we were able to do, and the food was truly amazing. So it was a very great experience to be able to spend a month working in such an amazing place.
Yeah, there were a lot of cultural things that we got to do, especially on the weekends when we had the full days. There were a lot of temples. There's a big volcano that we got to kind of explore around,
Yeah.
and just learning everything about the history. As far as food goes, there are plenty of places local that you can eat. Breakfast and dinner were provided by the hotel, and lunch we usually ate at the hospital. If you didn't want to eat the hotel's food that they gave you, you can just go right down the street and grab something. And as far as American food or Western food, they do have it at the mall, so if you're ever feeling like something from home, it's just very quick to get everywhere.
Yeah, food was definitely not an issue during this experience, and Elective International really went out of their way to make our daily lives outside the hospital very easy.
Yeah.
Um, in addition to that, our experience in the hospital was also something that was truly unique. Steph, I know you did pediatrics.
Yeah, pediatrics there was really good. I did some time in the clinics. They have a big polyclinic where you can pretty much roam around from infectious disease to pulmonology, whatever you want to do that day. And they're very gracious and willing to just kind of let you do whatever you want to see, you can be able to see. I was a little bit more interested in the tropical medicine aspect because I figured it would be the most different from the US. So I spent most of my time in the infectious disease clinic on the wards. They let me spend a week in the PICU, a week in the NICU. So it was really kind of cool to compare and contrast everything in the U.S. It's a big referral center, so the technology was really good, and the cases that you got to see were maybe some of the more progressed cases that you might not get to see at your local hospital in the U.S. because they may not seek attention as quickly as we would.
Yeah, I personally did surgery, and I can definitely agree that the technology was very surprising to me. The experience itself was amazing. I had initially scheduled to do cardiothoracic, followed by general surgery, and I ended up staying on cardiothoracic actually because I had such a great experience working with the team, and I really made a lot of friends in the operating room. So it was hard for me to switch to another subspecialty when I was having such a good time and I was getting so much hands-on experience. And that's something that they were really great about. They truly made me feel like I was part of the team. I spent a lot of time in the operating room. I spent a lot of time, hands-on, helping, closing. So it was a great experience for me. Stuff I'm going to be able to take back and use in my future career. A lot of things that worst case scenarios that I may one day see. So it was definitely a wonderful experience. And if you're a surgeon in training or a surgeon, you're hopeful to be a surgeon, I would highly recommend the program.
Yeah, and as far as pediatrics goes as well, our morning reports were all in English. The medical students were for the most part, very good at speaking English, and the residents as well. So communications with the patient was a little bit difficult, but at least I was kind of able to ask what was going on or get a good grasp of what was going on from the lectures or from just asking one of my medical student or resident fellows.
Yeah, primarily they also tried to present most of the cases in English as well, so I was able to grasp a lot of medicine around the surgery, and I think I definitely learned a lot in this last month.
Yeah, all in all, I definitely recommend it. From a pediatric standpoint, it was a great place to kind of view the differences, and just from a medical student standpoint, it was a really great experience to do the rotation in Yogyakarta. Like Omkar said, there's just so much to do, so much culture, and the people are just so, so nice.
Yeah, I highly recommend it as well. Good luck.